Medical abortion involves the use of medications to induce an abortion without using a surgical technique. The most common regimen in the United States uses mifepristone, followed by misoprostol, so two different medications. Mifepristone was approved in 2000, even though it's a very safe, simple procedure that could be provided safely by nurse practitioners, physician's assistants, nurse midwives. In most states, a physician has to actually provide the medication, and only about 15 states can those advanced practice clinicians provide the procedure. So telemedicine involves the use of communication and information technology in order to provide a health service at a distance. And it's being used in a variety of medical fields in order to provide a service where there isn't a specialist who can provide the service on site. In this case, Planned Parenthood of the Heartland developed a telemedicine model to provide medical abortion. Essentially, the patient receives the exact same medical care as if she were visiting with the physician in an in-person, face-to-face visit. The only difference is really how the medication is actually delivered to the patient.
The patient comes to the clinic. She's given all the appropriate paperwork to fill out. There's an ultrasound done to determine weeks of gestation of the pregnancy. She then receives information about the abortion pill and also about the in-clinic abortion, which would be the other option that she would have. Perhaps not at that clinic, but if she wanted to go someplace else. She also has some lab work done that's appropriate, pertinent to the care that's being given that day. After that's done, the patient will meet with a nurse or an educator to go over what her options are as far as pregnancy, and also to make sure that she's sure of her decision to want to terminate the pregnancy today. She would then meet with the physician, not in person in the room, but face-to-face on a video conferencing system. They can see one another and talk to one another in real time. All of her lab work, her ultrasound, her health history, that's all been sent to the physician via a secure internet connection. And instead of the physician being in the room with her to hand her a pill, she instead opens a drawer from far away via a secure internet connection. Both sets of medications are in the drawer that's then opened.
We worked with Planned Parenthood to evaluate the telemedicine model, doing several different studies. The first paper was published in the Journal of Obstetrics and Gynecology in 2011. For that paper, we looked at the safety, effectiveness, and acceptability of the telemedicine model. We performed a cohort study where we followed about 200 women who had chosen to have medical abortion using telemedicine and compared them to a group of about 200 women who chose to have a medical abortion with an in-person, face-to-face visit with a physician. We found that the effectiveness of the medical abortion regimen was very high, about 98% in both groups. And acceptability was also very high in both groups. The vast majority were very satisfied with their abortion procedure in both groups. But some measures of satisfaction were actually statistically higher among women who had a telemedicine visit. We also looked at the safety of the model by looking at all of the adverse events that the clinics are required to report to Planned Parenthood and to the manufacturer of the medication, and we found a very low rate of adverse events in both groups that was not statistically significantly different. For this most recent paper, which was just published in the American Journal of Public Health in the January 2013 issue, we looked at the impact of providing telemedicine abortion on the service delivery statistics at Planned Parenthood. We compared the 2 years prior to the introduction of telemedicine to the 2 years after. Despite starting to provide abortions at many more clinics, the total number of abortions provided by Planned Parenthood actually increased very slightly, only about 2% higher number of abortions in the 2 years after telemedicine was introduced. But the proportion of abortions that were medical abortion increased significantly from 46% to 54% after telemedicine was introduced, which isn't surprising given that all the new clinics that were providing telemedicine services were only providing medical abortion. Interestingly, the proportion of abortions that were done after 13 weeks in the second trimester decreased significantly. It was a small reduction, but a significant decrease. And because second trimester abortion is associated with more complications compared to earlier abortion. I think this is really an important finding. Women were significantly more likely to obtain an early abortion if they presented during the period after telemedicine was introduced. As you can see here in this map, we graphically can show how the numbers of medical abortion changed during the period after telemedicine was introduced. Areas that are blue are areas where there was an increase in the number of medical abortions provided to women who lived in that part of the state. And the darker the blue, the larger the magnitude of that increase. And you can see that there was an increase in the number of medical abortions provided to women who lived in far western part of the state, as well as eastern Nebraska, and also in the eastern part of Iowa and northwestern Illinois. So this really shows how women who lived in more remote parts of the state, farther away from the urban centers, were more likely to obtain medical abortion after telemedicine was introduced.
With Planned Parenthood of the Heartland providing the abortion pill via telehealth delivery system, it just opens up access. And as far as the impact on Planned Parenthood itself, I think that it's just made us be more efficient on how we provide the service. The physician can be here in Des Moines and be providing the service in Cedar Falls and not have to drive the 2 hours that it would take. So there is some cost savings in it for Planned Parenthood of the Heartland. And also then that cost savings can be passed on to the patient as well.
As telemedicine is being used more and more in the United States to provide a variety of medical procedures, this research really just shows that this is another application of this use of technology to provide access to early, safe medical abortion.